Hi, everyone. Gary here from the NKF, welcoming you to another edition of the National Kidney Foundation's NKF Live series. Today, we're going to be talking about what patients with kidney disease need to know about COVID and flu vaccines. So, flu season's upon us. COVID has unfortunately never really left. And that said, I'm lucky to be joined today by some experts on the subject that can help us understand what's going on out there. So, without further ado, my guests today include Dr. Neeraj Kothari. Dr. Kothari is a nephrologist or a kidney doctor, and he joins us from Mount Sinai School of Medicine here in New York. And we're also joined today by Dr. William Werbel. Dr. Werbel is an infectious disease expert, and he joins us from Johns Hopkins Medical Center in Baltimore, Maryland. Gentlemen, thank you so much for joining me today.
Thanks, Gary. Pleasure to be here.
Thanks for having us.
So, Dr. Werbel, let me start with you. Can you sort of give us a basic explanation of infectious disease, and especially as it relates to the topic of COVID-19 and influenza?
Sure, I think it's a big question, but for today, we'd really be talking about what we're going to focus on is respiratory viruses. So a subset of infections that we can pass among each other, usually by breathing, coughing, rubbing our eyes, or touching certain contaminated surfaces that can lead to disease, basically. And the ways that people feel or can get sick really vary depending on who we are, our age, our medical problems, including kidney disease. And so we can talk a little today about 2 or 3 of the major respiratory viruses that we're actually in a fortunate position that we have vaccines against.
Okay. Dr. Kothari, as the National Kidney Foundation, the reason we're hosting a program like this is because so many of our patients are susceptible or at risk for complications from things like COVID and the flu. So can you talk a little bit about why this is and why it's important that they get vaccinated?
Absolutely. And Gary, this is really a critical issue for the kidney community. Patients with kidney disease are at particular risk for serious complications from diseases such as the flu, COVID, and other respiratory viruses. And this is because anyone with kidney disease, whether they have chronic kidney disease, they're on dialysis, or they have a kidney transplant, are considered to be immunocompromised. That means their bodies don't fight off infection as well as someone without kidney issues. So it's easier for them to get infections because their defenses are lowered a little bit. If and when they do get infections, it may take them longer to fight off the infection, and they're at higher risk of serious complications from viruses like the flu and COVID. And that's where vaccines come into play and have such a major role in protecting the kidney community. Vaccines give the immune system a head start in fighting infection, so it knows what to look for. So if it recognizes a flu virus or a COVID virus, the immune system can mobilize its defenses more effectively. This reduces the risk of infection for kidney patients. It reduces the risk of serious illness and dangerous complications. And so it is really important that all people with kidney disease at any stage make sure to stay up to date on their vaccines.
Okay, thank you. Or anybody that's immunosuppressed, right? Not just
Absolutely.
kidney disease, but specifically kidney disease in our case. So, Dr. Werbel, there's the CDC comes out with new recommendations quite often. I think they came out with some relatively recently. Can you tell folks what they are and what people need to know about these new recommendations?
Sure. And I'll probably say there's a simple sort of answer and then a little bit complicated answer depending on how old you are, et cetera. I mean, simple answer, echoing Dr. Kothari, is that if you're a person who's typically, let's say, over the age of 60 or have a chronic medical condition such as kidney disease, you should get all these vaccines this season. So that's the simple version. The more complicated version is if we talk with, let's say, influenza, I feel like it's maybe the most simple. This is a vaccine that continues to be recommended at least once a year in advance of the flu season for basically everybody 6 months and older. And particularly for older people, to add a little nuance, there are some that are recommended specifically, and I think they're good ones for people with kidney disease, such as the so-called high-dose flu vaccine or an adjuvanted flu vaccine. Those are ones that have an immune booster in them. So there's certain ones of the yearly flu vaccine that would be maybe more a targeted recommendation for older adults and people with kidney disease. So that's the flu, the short and long. COVID, it's kind of similar. We now have a updated COVID shot, like we would have a yearly updated flu shot that's recommended for everybody ages 6 months and up, with the expectation that it would be given in advance of a COVID season. Unfortunately, Gary, as you mentioned early on, we've really had a kind of almost like a every 2 months COVID surge, and we're in one now, actually. So despite that, I would consider that, hey, use this updated COVID vaccine, of which there are 3 types, all of which are available for adults, as your yearly updated sort of booster for COVID. I don't know if we should maybe we'll talk about RSV. I could talk about RSV now or later. I would think maybe, again, the short version is for RSV, which is the third vaccine that may or may not be a focus of questions later. I would think of it in the same way right now as the flu shot. It's available for people ages 60 and older who are at risk, which I would consider people with kidney disease to be at risk, and offered this year in advance of the expected RSV season, which tends to be late fall and early winter.
So RSV, can you get into that a little bit? We were going to talk about that, but now that we're on it, go ahead.
For the sake of maybe being parallel, we talk about all these 3. So RSV is the new kid on the block in terms of vaccines, but it's been with us for centuries. And in older adults, and I would consider people with kidney disease in this way as well, it probably causes about the same amount of illness as influenza every year. But the difference was we never had a vaccine for it. And really, one of the blessings of this year is that we have a vaccine for RSV, which appears in trials, clinical trials of older and at-risk adults to reduce the potential to have RSV that causes symptoms and pneumonia at a pretty high rate. So I would kind of consider them in one breath, more or less, as another tool we have to keep people safe this winter.
Okay. So, and you keep saying yearly, and why is it that we have to get this stuff yearly? Is it, like the flu vaccine, COVID vaccines, we say that they're not really boosters anymore, but this is sort of a yearly thing. Does the vaccine sort of disappear over time? Does the virus mutate? What's going on?
I think basically it's those 2 things together. Everybody for most vaccines, particularly against these respiratory viruses, there's a period where after you get a vaccine, where there's a high level of antibodies and things that protect us, and those will wane naturally over time, meaning decrease over time. And why we call things or term things boosters is literally to boost up the waning immunity, the sort of decrease over time that's natural and expected. And ideally to do that in advance of a time where you're expecting there to be a lot of virus in the community. The second point, though, you made is also with these yearly updates, let's say, which seems to be the plan right now, we have the opportunity to better match the available vaccine to the anticipated viruses that'll be around. And we know this with flu. You probably heard the flu shot gets changed around every year, and it's because we're constantly sort of surveilling and watching what's going on around the world and trying to make a vaccine that has pieces of it that are more likely to match circulating viruses. And so COVID is a good example. Obviously, it's been in the news a lot with their variants that change over time. So the purpose of the currently most updated vaccine is to contain parts of it that are better matched to the viruses that are right now in the community.
Okay, thank you. Dr. Kothari, AKI, or acute kidney injury. Now, I know we talked about the importance for people that are immunosuppressed or that have kidney disease to get vaccinated. Why does COVID-19 cause kidney injury in certain people? And I say that because I remember when this whole thing first started several years ago, 3-4 years ago, a lot of the people that were getting very sick or dying, it was because their kidneys were being damaged. Is that right?
It certainly is. Yes, that was a tremendous issue.
Now, well, why was that? What happens? How does COVID lead to acute kidney injury?
Well, we're learning more about it as we go, but there are several reasons why we think it does. And one is generic to all types of infectious disease. Any serious infection, whether it's COVID, the flu, or any other type of infection, if it's severe enough, it can affect the blood flow to the various internal organs, including the kidneys. And we saw a lot of that in COVID, and we see quite a bit of that in other infectious diseases as well. And so when the blood flow to the kidneys is reduced, the kidneys don't work as well, and that causes a decrease in function called acute kidney injury. We're also seeing some evidence that COVID may directly affect different parts of the kidney. It may affect part of the filtering system of the kidney called the glomerulus, and one subtype of that effect is called COVID-associated nephropathy, basically COVID-associated kidney disease. And there's some evidence to suggest it may be similar to how other viruses may affect the kidney. So while we're learning more, as we see more patients with COVID, we see more patients with kidney disease from COVID, we already see that there are multiple ways by which COVID can affect the kidneys and cause acute kidney injury, that decrease in kidney function. And I think it's important to note that while people with pre-existing kidney disease are at higher risk of having an acute kidney injury, even people without any history of chronic kidney disease, acute kidney injury, dialysis, kidney transplant, people who may have been considered to be entirely healthy are still at risk for kidney injury from COVID infection.
Yeah, that's what I remember. So that said, Dr. Wirbel, what can folks do? There is fear out there. There's people see headlines, they read sound bites, they may not take the time to read an entire article or educate themselves about all of this stuff. Can you say anything to sort of help put people's fears or safety concerns or hesitancy at rest?
Related to vaccines or?
Yeah, related to the vaccines.
Yeah, I mean, I think kind of following what Dr. Kathari said, what we do know is that hundreds of millions of, for example, COVID vaccine doses have been given to date. Like what I'm saying, literally hundreds of millions. And we've not seen something like people developing high rates of kidney problems related to the vaccine. So, and we have seen that additional vaccinations, particularly once you've had 3, 4, and a relatively recent booster vaccine, reduce the risk of not only getting infected for a time, but developing disease that puts you into the hospital or gets dehydrated or leads to, low oxygen. And those are the things that can lead to, for example, worsening kidney injury. So clearly the balance here in terms of kidney safety and health, it would be in favor of getting vaccinated to try to reduce the thing that might unfortunately lead to downstream kidney problems. And that paradigm, that kind of like explanation holds for all the different vaccines. We don't have as much experience with the RSV vaccines because they're new. There are trials that were just recently published. However, at least with those, it's thousands of people, including pregnant women, for example, pregnant persons, in whom we didn't see things like kidney problems, and we did see things like preventing getting infected and preventing getting pneumonia. And I think the number one thing for vaccine manufacturers and the government is a vaccine safe? Actually, that is the first bar, and all these vaccines have cleared that bar. Then the second is, does it prevent serious disease, right? And I think that message is something that has been lost a little bit or has led to some vaccine fatigue for people because they're like, oh, I can still get infected if I have a vaccine. Well, it's actually not the point of vaccines against respiratory viruses. It's preventing you from getting seriously ill or having complications like kidney problems from being from getting infected. So the vaccines that are all available are safe and to prevent severe disease. And so those are probably the two biggest things in their favor and why we continue to recommend.
Thank you. Okay, so the vaccines, masks is the obvious one. But it's also important, Dr. Kathari, right, also for family members, for caregivers, for people in close proximity to be vaccinated, to wear masks. Are there other preventative measures that people can take aside from just getting the vaccine and wearing masks?
Definitely. And I think that's a good point because, as Dr. Wirbel mentioned, I think a lot of people, perhaps including myself, really want COVID to go away. And we all want it to go away. We all would rather just be done with this. And it's okay to feel that way. I want to emphasize that. We're all feeling that. No one likes COVID, but we all have to do what's right for ourselves and each other. And so it's definitely important to continue to take these measures so that we can protect ourselves and protect our colleagues, our friends, our loved ones with kidney disease. And it may be more important for people with kidney disease because of what we mentioned earlier, that they are immunocompromised. Their immune systems do not work in the same way as people without kidney disease. And so they are at significantly higher risk of really serious complications as a result of COVID infection, flu infection, RSV infection. And so, as you mentioned, masks are definitely an important part of that. It's important for everyone around kidney patients to make sure that they are up to date on vaccinations, because what may be a mild infection in someone without kidney disease, or maybe even completely without symptoms, could become a very serious, devastating, or even deadly illness in someone with immune system issues, like someone with kidney disease. And so it's really critical for everyone around our kidney patients to be vaccinated, to practice these safe hygiene practices, because no one wants to be in a situation where they accidentally introduce an infection to someone with kidney disease that ends up being extremely serious. Masks are important. Vaccines are important. And of course, hand washing is critical. That is one of the best ways to prevent the spread of any infection. People are trying to socialize as we get into the fall, as we get into the holiday season. People may be moving indoors for some of their social activities. Whenever possible, staying in a well-ventilated space, maybe maintaining a few extra feet of separation, 6 feet or so, using outdoor venues whenever possible will all help to reduce the risk of transmission of diseases like COVID, like the flu.
Okay, great. Thank you. What about the vaccine cards? I remember, a couple of years ago, vaccine cards everywhere, and you got to get these things signed for travel, for going to a sporting event, a concert. Are the CDC still issuing the cards? Are they needed?
Well, I do know that if you get vaccinated, you can still receive stickers, and they should be putting stickers on a vaccine card for you. But as kind of a reflection of societal normalization, it's very rare that there are venues or places or travel type restrictions related to not being vaccinated. And that is, again, probably mostly a reflection of the vast majority of people having been infected and or vaccinated before. And so the risks to them and the risks of um, spread in like a so-called naive population, people who've never been exposed, is lower. And so I'm not that, there may be some sort of select situations or select regions where that's performed, but it hasn't as much been the case. And, it doesn't mean that there's no disease in the community, but it just reflects that, we've been through a lot. Our bodies and our society have been through a lot, and we're at a stage where we're kind of easing more into sort of normal operating.
Okay. And in terms of the vaccines, and I think this is an important one for folks that are maybe watching, are prescriptions necessary? The public health emergency has been lifted, and so there may be costs associated with this. Is this stuff covered by health insurance, Medicare, Medicaid? I think people are probably asking themselves those questions. And I think we're going to pull up a slide here that will illustrate some of the answers to that. But can you discuss that briefly?
Yeah, I don't know, Dr. Mathar, if you've had patients who've spoken to you about issues or not. I can share as well.
Yeah, absolutely. It's an ongoing question. And many of my patients ask, how much is the vaccine going to cost? Where can I get it? Here in New York, there's pretty good coverage. Medicaid, Medicare both cover it to an extent. it varies state by state. And so it's important to understand what the laws and regulations are in your particular state. And it's okay if you don't know. Your physician or primary care provider will always be happy to tell you that information and give that to you so you can make the best decision for yourself.
Yeah. I'll mention vaccines.gov as a website that anybody can go to, easy to remember. And if you were to look for COVID vaccines or flu, you put in your zip code, click which vaccine you're interested in. And there's a box usually for something called the Bridge Access Program, which has basically been the stopgap funding stream to have for people who are basically uninsured or underinsured adults to be able to get vaccines, ideally free. There can be variability, and there may not be places near you that participate in this program, but it is an option. I also know that departments of public health, state and county, have been allocated a certain number of vaccines to be given to people who are underinsured. And lastly, although my understanding is not the RSV vaccine, for example, may not be covered under Medicare Part B, should be covered under Medicare Part D. And if you have Part D and there's some issue, that's where a prescription can come in, because if your doctor writes a prescription, it should be covered under Part D, is my understanding. So there are a few holes in there, but it's generally navigable. And I agree, talking to your healthcare team can maybe help.
Thanks. And, you can always check on the National Kidney Foundation's website at kidney.org. A simple search for COVID or coronavirus or vaccines will lead you to a ton of information that can hopefully be helpful to you. So just looking at the clock here, what I want to do now is I want to take a look at some of the questions that folks that have been watching have been asking. I'm going to remind folks that if you have questions on this subject, post them in the comments section. We're going to do our best to answer as many as we can. If we run out of time, just know that all the questions will be addressed on the NKF's various social media pages and web pages after this program. So let's see what we got here. Here is a question from Jim in Haddam, Connecticut. Jim wants to know, what do you say? Can you talk a bit about the different variants? Will this latest vaccine protect against the current variant?
Sure. I'm happy to take that one. If we're talking about SARS-CoV-2 or COVID, the short answer is yes, they're predicted to provide specific or active immune response against the newer variants. So the code vaccine that for all the three types that are available is the one of the most recently circulating kind of superfamily of variants. And preliminary data from the drug companies reviewed by CDC, et cetera, show that these vaccines boost up immunity against some of the newer variants, and including ones you might have heard on the news, like BA.2.86, some of which have funny names and everything. But essentially, they're all Omicron children or grandchildren, and this is an Omicron vaccine. So that is predicted to be the case.
If I may add to that a little bit, what we saw with some of the previous variants, Delta was in the news for a while, Omicron in the news. The vaccines that were available previously did have some decrease in effectiveness against getting the infection. But as Dr. Roble mentioned earlier, the point of these vaccines is not just to prevent infection, it's to prevent the serious complications that can occur with this infection. People can go in the hospital, people can have kidney injury, people can die from these infections. And that's really where the vaccines have their greatest benefit for these respiratory viruses like COVID and the flu. And I'd love to hear your opinion, Dr. Roble, on this. But from my standpoint as a nephrologist, what I've been counseling to my patients is that as this virus mutates, yes, there may be a need for updated vaccines, but they still provide significant protection against the most serious complications, against the need for hospitalization.
For sure, I would agree with that. And I think they basically lead to a shift in the kind of spectrum or, where people lie in terms of how sick they are. If you were sort of over here in terms of unfortunately, people dying or getting in the ICU, basically everything gets shifted. Some people can still get infected. People might occasionally still be hospitalized, but you avoid that tail end of bad outcomes, even with variants that change.
Great, thank you. Here's a question from Thomas in Los Angeles. If I'm on a transplant wait list, should I get vaccinated or should I wait? Great question.
I think I can take this one, and I agree. It's an excellent question, and one that I'm quite frequently asked by my patients who are either on the transplant list or contemplating kidney transplant. And the short answer is yes. It is always a good idea to get up to date on vaccinations before a kidney transplant. And there are multiple reasons for this. One is that if one is on the kidney transplant list, one either has significant chronic kidney disease or is already on dialysis. And as we discussed in the earlier part of the program, all people with kidney disease are immunocompromised. They are at higher risk of getting infected. It's harder for them to fight off infection, and they're at higher risk for serious complications from these infections. And so the most important reason is to get that protection as soon as possible. The second reason is that kidney transplant, particularly the medications that are used to protect the donated kidney or donated organ from someone's immune system, also alter how one's body responds to vaccination. It may take longer to build immunity after a given vaccine. It may be more difficult to build immunity from a given vaccine. And some vaccines, certain types of vaccines, should not be used in people who have had transplants because of an additional risk of complication. And so for multiple reasons, it's really critical for anybody who is thinking about getting any kind of transplant to make sure that they are fully up to date on all recommended vaccinations. And if you have any questions about that, your transplant team, your nephrologist will always be happy to answer those questions.
Okay, thank you. So just a follow-up on that, you mentioned dialysis patients. Dialysis centers are one thing. We are often recommending home dialysis as an option. Is that something that patients should consider or at least discuss with their healthcare team?
Absolutely. And dialysis patients are in a unique circumstance, particularly those who are on what is called in-center hemodialysis. Those patients who are traveling to a dialysis unit several times per week, usually 3 times per week. It's a unique circumstance because they are interacting with and being exposed to the healthcare system far more frequently than the average person. And when there is a large group of people in any given room or any given setting, it increases the risk of exposure to infection. And there are already significant benefits to home dialysis, even without thinking about this infectious risk. But home dialysis is another great option because it allows our kidney patients to get the treatment they need from the convenience of their own home. They don't have to travel to a dialysis unit. They don't have to sit in the dialysis unit for hours. They can get their treatment from the convenience of their own home. And now we're seeing this additional benefit that it significantly lowers the risk of being exposed to these infections like COVID and the flu because they're not having to travel to this healthcare facility multiple times per week. They're able to stay at home and get their treatment.
Yeah, great. Well, unfortunately, we run out of time. In case we didn't get around to answering your question today, just please check back on the National Kidney Foundation's various social media pages. We're going to be posting the answers throughout the coming days. I want to thank our sponsor, Moderna, for their generous support in helping to make this program possible. I'd especially like to thank our guests, Dr. Kothari and Dr. Werbel, for joining us today and helping us get a better understanding of the subject and all of the issues that come with it. Thank you so much, guys.
Really enjoyed it. Thank you for having me.
Thank you.
So now, on behalf of the National Kidney Foundation, I'd like to wish you all good health.